now individualized medicines are possible, period, right? They've happened. So it's here. The question now is, this is a new way of thinking how to treat. I'm going to use rare disease it's a new way to treat medicine, but I'm going to say, anyone, but in rare disease in particular, it's a new possible platform solution to what I consider an incredibly devastating problem. 60 million children that have rare diseases. I mean, it's drastic. And I look back I've been doing a lot of research in the HIV and AIDS era and how that changed drug development. COVID is a good example. My mother has stage 4 cancer, so I've been learning all about oncology as well. Rare disease in children alone is drastic. I mean, it's up there, if not worse than all of these. And 60 million children, each of those have a whole family that's taking care of them. So the ripple effect is pretty huge. And to have a possible platform solution for something, that Mila has broken the ice, but now we have to face it. We have to talk about how do we do this, So I guess the question I have is that I think about is, can we repeat this? Can we scale this? The only way to do that is to treat more children and to get more data and to learn, does it work? Is it safe? And the only way to do that is to treat more children. I think that sometimes individualized medicine scares everyone in this industry because it seems like, my analogies, it seems like a new sport and we don't know what the name of the sport is. We don't know what jerseys you wear. We don't know how big the field is or where the goals are. And, what does the ref do? And, it's kind of scary. Instead of thinking of it that way, I'm starting to think of it more as kind of modernizing the system instead of tearing it down. The system exists. Now we have this kind of new paradigm. So now we kind of have to just modernize with it and not start from scratch. It's not a new sport, So that's my first kind of thought. And if it's okay with you guys, I'd love to talk through a few of these points, and then I'd love for you to go back to any of these and ask me any questions. So I'm thinking a lot about it as modernizing the current system. Another topic that comes to mind is kind of what the goal or the purpose of an individualized treatment. I'm going to use Millicent specifically. What was the purpose? It was an intersection of compassionate use and research. And in fact, that is actually what happened, because the original goal was, can we do something that could actually stop this disease? And we started learning, well, maybe this actually could really help research as a whole for all rare diseases. And we wanted to stop, or I'm very hesitant to use the word cure, but stop this disease. And it did stop it. It did improve it. And it was successful in that way. Over time, we learned that it didn't stop it. It was too late for Mila. Too many dominoes had fallen. She was 7 years old. The processes in her neurons had already continued, I think, too far down the road. But then it turned into a quality of life. So a kind of a different purpose and goal. So I questioned and I thought to myself, should I continue Millicent? A number of times, probably more towards the end of the second year, maybe into the third year mostly. But I saw that, it's a small disease. We only have 30 people that we know of in the world. So the natural history is what it is. We just know that it's a very steep decline and that you lose pretty much all of your abilities except for hearing, so it's very obvious where Mila was going. And, Mila was on 0.5 ml of one seizure medicine. Most kids with that are on 2, 3 to 9 at the same time. We were almost never at the doctor's office. We were not helicoptered there. She did not stop. We didn't have a shaking vest. We didn't, her life, her quality of life, even when I could see that we couldn't stop the disease, was drama free. We didn't have all the side effects of all these medicines because she didn't really need them. So Millicent was, I am guessing as a mother, that it was greatly controlling her seizures, at least in the minimal, because she was on such a low dose of seizure meds. And she started having seizures more in the third year for sure, but they weren't dramatic. They were tiny little movements of her head. And our life was not medical, which it kind of should have been. And so I think it's going to be important for these individualized medicines to realize, especially in these first few years, and especially in these more serious cases like Mila's of degenerative diseases, is that you may set out, our goal is, can we come up with, let's say, ASOs that stop diseases in time? We diagnose them earlier, we get to them earlier and they can stop the disease. But even in these early years where it may shift to compassionate use over time because children are progressing quickly and we get to them too late, that still has an enormous value, enormous. I can't even tell you as a mother, I didn't have drama in my life. I had sadness that I couldn't stop her disease. But both the stopping of the disease and eventually coming up with a quote unquote cure, and for research purposes, and then compassionate use kind of really helping quality of life. Those are two goals or purposes, I think, of an individualized drug that can happen simultaneously. Another topic, which I think is an important one, is setting expectations correctly for families. I can only tell you in my specific situation that Dr. Yu was great with me in the sense that he explained things from the beginning that helped me have, like I always say, I had a foot in hope and a foot in reality. I was always tried really to stay grounded, even when I was so hopeful, and I'm a very positive person. But I didn't ever shift fully to one or the other. Dr. Yu explained, to give you kind of concrete examples, I remember him explaining the difference between Batten and SMA, because, you know, Mila's drug was being based on Spinraza, which was so wildly successful. I remember him telling me, you know, Julia, SMA is in the spinal column. So you're giving a drug in the spinal column, and that's where the disease is. For Mila, you know, it has to travel up her spinal column, and it has to penetrate the brain and get down to the depths of the brain. And, you know, that's harder to do. We don't know yet. You know, we've only kind of used an ASO through the CNS, you know, through the cerebrospinal fluid, you know, for a disease that is not exactly the same as Batten disease. So like, you need to understand the difference. He also explained to me that, which I thought was a really helpful visual picture. He explained to me, hey, you know, Mila's neurons are dying. Some of them have already died. Some of them are in the process of dying, and we might be able to stop that. And some of them are in the process of dying, and we might not be able to stop that. And, you know, that was an incredibly helpful thing to know from the get-go, because that's kind of what I saw is Mila was in this kind of limbo, you know, where some of her disease may have stopped and slowed and other parts didn't. And, you know, that eventually leaves parents later at some point in a point where, do I like the place where my child has landed that's in this kind of limbo? Is that a good quality of life? And that's a different discussion. But I think he correctly set those expectations, and I really kind of always was able to have hope and reality as both sides of me every day of the last, you know, 3 years. Another topic, which I think is important, is that we often talk about the risk-benefit paradigm. And it took me a while to find the right terms because it never felt right for Mila, is I kind of changed the terms to fit what made sense for me in this kind of new individualized medicine world, where it was the risk of treating Mila specifically versus the risk of not treating Mila. And when I faced this treatment, people have asked me, like, did you have hesitations? Were you scared? You know, I wasn't, because the risk of not treating Mila, it doesn't matter whether she stopped talking at 6 or 7, like their natural history matters, but for a degenerative disease that's fatal, to me as a parent, it doesn't really matter, because you look at all the kids and pretty much all of them, unless you have a really crazy variant, and Mila was following very typical progression over the first 7 years of her life before she received that. You know, clearly, like, the risk of not treating her, we knew what the line was going to look like. It didn't matter if it was off by a few months or a few years, like it was going down steeply and it was going to end sometime in the next few years. And so when I thought about the risk of not treating, it was obvious. When I thought about the risk of treating, I thought, well, you know, I did my homework. I talked to Tim. ASOs, there were decades of experience, especially with animals, you know, with ASOs. And so it wasn't voodoo science. There weren't feathers and gems involved. This was very legit science, and it offered Mila hope. Was it going to work? We didn't know, but it made sense to me, especially when, you know, her cells in the lab, for whatever it's worth, which was worth a lot to me, you know, were being restored to health in the lab. That was a big deal, you know? And so as a parent, it seemed like unethical for me to not at least give it the best shot possible in this very legit science that could be applied to my daughter, and her cells looked like they were responding really well. So the risk of treating her was, I never spent 1 second questioning whether or not it was worth treating her. I told myself the night before we started Milasen, I said, I hope that Mila either dies on the spot, because as a parent, that's what you kind of hope, or that this is going to work. Now, obviously, I know that that's not so black and white, but that's what was going through my head at that time. And she didn't have any adverse reactions to it. And, would I have gone back and ever changed anything? No, not at all. So to me, it was the risk of treating versus the risk of not treating. There is an analogy that's come to mind over the last few years, just probably recently in the last year, is that the analogy kind of feels like a brain tumor. It feels like a friend of a friend just lost their little daughter to a brain tumor. And, when she went into the doctor said, you have a brain tumor. If you don't take it out, this is what's going to happen. You might lose your vision, you might lose your ability to walk and talk, you might die. If you, and I'm sure gave percentages and, chance, if you go in and you remove the brain tumor, there are risks involved, and you might also lose your vision, you might lose your ability to talk, you might die, and here's some other percentages, right? But I hadn't really thought of it that way, but because something like a brain tumor is kind of individualized in a way, it's very specific to that person and where that brain tumor is and what are the risks for that kid, It felt similar when I heard that conversation. I thought that's actually really similar to what went through my head. So anyway, that's just an analogy to think about. Another topic which has come up, and I think a bunch of you guys have brought it up, is equity. And I think that the way I think about this is that the ultimate goal is that, and I started coining phrases that may or may not make sense for you guys, but I took it from kind of the college process, admission process, is like need blind patient selection. The ultimate goal is that we are choosing patients based on whether their disease and their mutation is amenable, whether the child is in the right place in their disease to really make an impact and potentially stop the disease. That's where we're headed for sure. However, we are in a transition time right now. And the reality is there is not funding for these diseases. For rare diseases in general, and certainly not for individualized treatments, there isn't funding. So the reality is, whether we like it or not, the people that are funding rare disease, I like to consider rare disease parents almost as like a parallel NIH. I mean, the amount of money, I'd love to see the statistics, and no one seems to have them, of how much money rare disease parents have put into rare disease treatments is massive. And I will tell you, in this first wave, this last few years, most of these parents, including myself, you don't win. I mean, I like to consider myself win because Mila's quality of life was improved. So I don't want to say that I lost. However, these parents that are raising money are generally right now, yes, they could be helping their kids for sure, but it's really helping push science forward because no one else is funding rare disease treatments. So I consider this a transition time where it's an opportunity to me. If parents, it's sad that the burden falls on me when I want to spend time with Mila. I lost a lot of time with her so that I could, raise the money and the awareness and put the scientists together to make Milasen happen. Would I ever change that? No, not at all, because I gave her the best shot possible. But in the meantime, I did realize, like a lot of these parents, I realized pretty quickly that this was maybe not time for Mila. But I felt, and I still feel today, why I'm here today and why I continue to do this, is that I'm now on the other side of the glass. I see what it's like. I didn't know this world existed, and it needs voices and it needs people and it needs money to get going. And right now, today, it's the beginning. It requires families who are willing to raise money and awareness and put scientists across institution collaborations that wouldn't normally happen. And they're able to do that. All that stuff is necessary right now, hoping that we can move towards a system that is more need blind and that is not funded by parents, and that we have a more scalable model, that allows for funding to come from another source. But that's not the reality right now. So I try to turn negative situations into positive ones. And I see this more as an opportunity than anything else. Another question that Allison asked me to kind of talk about was my son, Aslan, who's just turned 7, and just how I communicated about Mila, as a sibling. And, he was very young. So he's been brought to every doctor's appointment, his entire life until a month ago was Mila. So I didn't have time to teach him how to ride a bike. Barely did. I didn't have time to teach him how to swim. I didn't have time to do puzzles with him, and I did. I'm a very hands-on mother, so I spent a lot of time with him, don't get me wrong. But, I recently realized after Mila passed away that I didn't really know my son. And I told him that, and he said, I know, mommy, I know you were always thinking about Mila. And it's like the first time in, the last month that I actually can sit and be present. I'm here right now in New Mexico with him, because it's my first road trip and chance to be with just him and be able to spend time with him, and I was so afraid that he was going to feel left out and feel resentful, because I had always focused on Mila. But instead, I see that he's really turned that to be such a good person, so helpful. Just yesterday, I was in a little coffee shop here, and he walked up to a woman who was working and said, "Hi, I have a sister who died, but she had a rare disease. And what I love most is nature and rare diseases. When I want to grow up, I want to be a doctor and help kids with rare diseases. And my mom wants to work with doctors and he told him this whole thing. This poor woman was sitting there. She was actually really nice, but I can see that he really cares, and that what he got out of it was he saw me fight for Mila. He saw me try to take care of her and interact with her. He saw that life isn't fair, and that, having a positive attitude and turning really negative, sad things into things that are opportunities to appreciate what you have, and really live in the moment, and really appreciate with Mila the tiny things, singing to her, putting my hand on her. We couldn't travel, we couldn't go do activities, so we had to stick to really simple things. So he's a kid who doesn't need a lot to be happy. He understands that little things, are what matter. So, and then as Mila was kind of ending the end of her life, I wasn't sure how to handle that. And I got some good advice from some friends who've gone through a lot of grief in their life. And they just said, don't tailor this to him. Just ask him if he wants what he wants to know, and I did. And I was scared about that, but he was amazing. And he said, I want to know everything. So I told him everything about what was going on in my head with Mila. And I said, do you think she's happy now? And he said, no, she's been really happy for a long time, but just recently she doesn't seem so happy, and so I really included him in the entire end of life process, more than I thought any 6-year-old at the time could ever handle. And I didn't want him to look back later in life and feel like confused, like what happened? I had a sister and she got worse and then she just disappeared. And, so I definitely did not keep him out of that. He was very involved. And I see him now thriving. I'm surprised. I'm shocked. He understands. He talks about rare disease all the time. He asks every time I bring up any kid. He said, Mommy, I want to know the exact name of that rare disease, and I want you to explain it to me. What happens in that disease? So, I hope that Aslan takes what was very sad and negative and turns it into something where he can help, as he gets older. The last thing I wanted to bring up was more than just because people have been drawn to it. So I thought I would just highlight it, and I'll screen share in just a minute, is in the last 6 months of Mila's life, I had a hard time because the whole world seemed to have their eyes on Mila, and they saw me fighting for her. And at that same time, I noticed that Mila wasn't doing well. And I didn't want to, I'd always been really honest about Mila. And I didn't want to feel like I was just showing like that really rare moment when she almost smiled, and on social media, or, when I was giving presentations, people would say, how's Mila doing? And I didn't know how to answer that, like not well, but she's doing a lot better than she's supposed to be, but I don't really love her quality of life. And she doesn't seem very happy right now. And so I asked a photographer friend of mine, a number of friends said to me, Julia, I wish people could just come into your house, and just see what your life is like. And so I basically had a photographer come over unannounced for 6 months, just all the time, every few days. And she would just show up and really do these kind of black and white photos that were photojournalism style. And she just caught our life. And I don't want to spend too much time now because we don't have much time. I will just screen share really briefly if it's okay. Let's see if I can. So if you can you see my screen?
Mm-hmm.
Okay, so I launched this, and I've been publishing these on social media, and I've noticed that a lot of people in the industry have been looking at them. I've kind of thousands every time I publish. And these were photos where I tried to capture my daily, life. And it was primarily for me to really get through a period that I knew was going to be really difficult. It helped me kind of heal. But it turned out that a lot of people were looking at these in the industry, and I really wanted to show kind of the weight, have people feel the weight of what it was like to live with a rare disease, not just a presentation at a scientific conference where you talk about numbers, like 60 million kids have rare disease, and I look around the room and no one's kind of flinching. I really wanted people to actually feel what it was like to be in a home with a child and be in an average moment, where, this photo, for example, I try with my copy when I write it to really stop and look at the picture for like 10 minutes. And I think, what did I feel like, that this was just the day before or something, and for me, it was, when I was fighting for Mila's treatment, I was on a mission to keep her walking. She pushed her stroller down the block and back every day. With treatment, her posture and steps stabilized, even improved. But over this past year, Mila's determined little feet dragged, then finally gave up. The thought of a wheelchair is unbearable. So I pick her up and carry her, always careful not to let her feel the impact her 62-pound body has on my back and neck. I take a breath, relax my shoulders, and talk to her quietly as I carry her. And so that was a very common thing for me, to really hard to carry her, but I didn't want her to feel that it was hard for me. So I will send you guys the link to that. You can look at it later. I just thought it was an opportunity once again to, there we go, an opportunity for me to let people in the industry see and feel more than anything what life was like. And I'm continuing to follow it. I wasn't going to, but I'm continuing because I am a single mom of Aslan, and I have to continue living, and I have to find a way to live without Mila. And I feel like no one really wants to go there, but I want to make sure that I'm bringing up these topics and continuing to talk about them. Happy to add one more thought if it's helpful and have anyone react to this, because I was realizing that I kind of had some concluding thoughts that, how do I just say this? So, 60 million kids have rare diseases around the world, and I was just reading a statistic that NORD put out yesterday that was talking about how, there's only, a few hundred treatments for rare diseases. And of those, only 10% of them can actually affect 3, conditions or more. And so, when I look at individualized medicine, I see this as an incredible opportunity because it is a platform approach which could cut across a ton of diseases. And for me, the fact is that a platform approach is needed to make a real impact. Otherwise, we're going to be sitting here in 10 years and we're going to have, a few more, however many more treatments. And it's not going to be enough to really make it. There's going to be children getting worse and dying and living lifelong, devastating, lives, their entire lives, unless we do something about it. So having a potential platform approach to me is an incredible opportunity, and it deserves really safe and careful and aggressive exploration. So for me, my hope is that, this group of people can help face these questions with the goal of giving this platform approach the best right now, because we need to do this. And as a parent, I'm going to go as far to say that if we as a rare disease community, everyone involved, if we don't do this, if we don't make Everest smaller and, add some maps and some trail maps and some guides and some, if we don't do that, that's actually unethical to me, because I think that these children and families like mine are living horrendous lives, have no hope, but to have a platform approach that should be explored and might actually really be able to help. It's not only true for ASOs, it's going to happen with CRISPR. I mean, it's just a matter of time. There'll be other individualized medicine approaches, and they are going to depend on this platform approach. So I just wanted to throw that out there as something else to maybe react to.